Good evening. I'm psychiatrist Jay Fauver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call here in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fauver, I've had a tough time the past few years, but I'm hopeful things are on the upswing. I'm much happier than I have been, but there's still a bit of anxiety and depression several days of the week. All of this has me wondering if good mental health equals happiness. Is that a fair expectation? Well, keep in mind that happiness, anxiety, sadness, anger, apathy, those are all normal emotions that should occur based on your life circumstances. Otherwise, if you're perpetually happy and joyous, well, you wouldn't appreciate the downswings. You'd be constantly on the high, and you wouldn't appreciate the downtimes. And the downtimes kind of help us remember what it's like to have the good times, and it gives us a gradient of the mood valence, so to speak. So yeah, it's expected. We're going to have some good days and bad days. And again, it's usually based on life circumstances. Where it's a problem with a mental health issue will be if it's causing you functional impairment, and if the moods are unnaturally up, down, angry, whatever, on a day-to-day basis, no matter what the circumstances. And that's what we call functional impairment. Functional impairment will be where it gets in the way of your work, your socialization, your marital relationship, and you're actually having problems on a day-to-day basis, getting out of bed, getting things done, doing what you need to do. So having some anxiety, having some depression here and there, it's really okay. Anxiety, as a matter of fact, can be very motivating. It's good to have anxiety, for instance, as a student before an examination, because anxiety will fire up your thinking part of your brain and help you kind of get through that exam and the studying process necessary to do it. So if you have something as an expectation coming up, having some anxiety around that expectation is fine. It actually fires you up. Feeling sadness periodically, well, that's really okay too if it's something you're grieving or something where you're disappointed in how an outcome might have evolved. It helps you realize that you might not be in control of things yourself, helps you kind of readapt your goals and your thinking, and gets you pointed maybe in a different direction. So having moods that might not be comfortable temporarily is really okay. Having those kind of moods and having that experience is fine. It's just that if it's there more often than not, that's where it's becoming a problem for people. Thanks for your email. Let's go to our first caller. Hello, Dan. Welcome to Matters of the Mind. Dan, you want to know about my thoughts on eliminating ADHD medication. Are there natural solutions or exercises to help for focus? When I think about ADHD, Dan, I often think about nearsightedness. Some people need eyeglasses all the time because it corrects their vision. You mentioned helping with focus. I'm talking about helping with focus for vision. If you need eyeglasses to correct your vision on a day-to-day basis, well, they can be very, very beneficial. If you don't need eyeglasses on a day-to-day basis and you only need them for reading, yeah, maybe you can just use them every now and then. ADHD is a similar phenomenon. It's where people since childhood, on more days than not, will have trouble with attention span, focus, distractibility, getting things done, prioritizing things, having vigilance in getting something started, then getting it done. People with ADHD will often be fairly impatient. You know, from a behavioral standpoint, ADHD would be fine if you're a hunter, because as a hunter, you're going to notice things other people might not notice. So it can be very adaptive in certain situations. So ADHD, I think there's controversy whether it's a disorder or not. It's probably a character trait where some people will have more difficulty in some areas than others. People with ADHD often will do very well in exciting, challenging, innovative kind of situations, firefighting, law enforcement, computer programming, sales. These are people will often be in those kind of areas with ADHD because things are happening very quickly, and when they do, a whole different part of their brain will kind of kick in. So what kind of things can you do naturally for ADHD without the medication? If the medication is necessary, okay, make sure you get on the right medication. fine-tune it as well as possible, because the problem with ADHD medication could be if you get too high of a dosage or too low of a dosage, it won't work so well. So it's like eyeglasses. You got to get the right lens strength on eyeglasses to get the proper visual focus. With ADHD medications, you also have to get the right dosage strength on those. But what can you do otherwise? You can identify the areas where you really struggle. If it has to do with paperwork, which is a big problem for a lot of people with ADHD, get the paperwork done, make a list. List making is wonderful for people with ADHD because it helps them prioritize. You're not going to do anything else until you get the first thing on your list done. You don't want to do it, it's boring, it's not challenging, but you got to do it. So get yourself in the mindset that you're going to have a list and you're going to prioritize things on those lists, and don't go on to the second or third things until you get the first thing done. Many people with ADHD will get started on something, find it not so challenging or get kind of bored, they go to something else, They'll have 4 and 5 different things going on at the same time, but nothing is getting done. So make a list of things and challenge yourself to get it done. Secondly, you can physically exercise. Physical exercise is remarkable for ADHD. And in some schools years ago, they took away recess. And with recess, it's time for kids to get out and have some physical activity. That was devastating for a lot of these children with ADHD because they couldn't basically burn off some of their extra energy. So with ADHD, it does help to exercise. It calms the brain and can help a person focus a little bit more. Adults, what can you naturally do on a regular basis? You can make the list, you can stay more physically active, and check in with other people based on to determine how you're coming across. And don't be the first in the room to give suggestions if you're in a meeting, for instance. I often recommend people with ADHD to have a cup of water, some kind of beverage in front of them, and before they want to blurt out something because they know what everybody's thinking, presumably, try to take a sip, think for a few seconds there. Don't blurt out something even though it comes to your mind, because people with ADHD, not uncommonly like people with autism, will often have a different networking in their brain. They think differently. Be aware of that and try to compensate accordingly. Dan, thanks for your call. Let's go to our next caller. Hello, Jill. Welcome to Matters of the Mind. Jill, you want to know, is there any relationship between bipolar disorder and hoarding? Not a direct relationship between bipolar disorder and hoarding. Hoarding is where you collect things unnecessarily. Bipolar disorder is where you'll have unnatural highs that can be characterized not only by euphoria or a really happy feeling. Sometimes people have irritability when they have the highs, but those highs will go on for several days. They'll not need to sleep so much during that time. They'll be more impulsive. It could be vaguely related if you become more impulsively hoarding during that time, but you usually don't hear that direct connection. Hoarding used to be thought to be a characteristic of obsessive compulsive disorder. Now hoarding's kind of in a category of its own, where people are unnecessarily keeping things. They have trouble throwing them out. They kind of have a emotional attachment to all these different things they've collected, so they don't want to get rid of things. Bipolar disorder is where people will have the highs, and then lows will be where they don't want to get out of bed. They socially withdraw. They're very, very sad during that time. So there's highs on where they go to the mountaintop and the lows where they go in the valleys with the mood. Hoarding is entirely different. Thanks for your call. Let's go to our next caller. Hello, Sally. Welcome to Matters of the Mind. Sally, you mentioned you're going through menopause and you're having a lot of brain fog. Is there anything you can do or take for mental clarity? Sally, brain fog is very common during menopause because this little area here called the hippocampus, it's the memory storage center of the brain, that's studded with little estrogen receptors. And when you are going lower on your estrogen as you go into menopause, average age used to be 51, it might even be younger than that now. But when you go into menopause, your estrogen level is going down, 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 down. With less estrogen, you have these little receptors just starving for estrogen. They don't have them, so you can't think so clearly. So mental fogginess will be a common characteristic. What can you do naturally? I wish I could tell you to take this or that supplement. Doesn't work that easily. Physical exercise does help for anybody with a mental health issue, but taking natural supplements may or may not help. From a medication standpoint, if the brain fog is significant with depression, which sometimes will accompany menopause, we're having particularly good luck with medications that are kind of more activating and energizing, perhaps like Trintellix, Wellbutrin, also known as Bupropion, Trintellix, also known as Vortioxetine. Those are the main medication we're using right now for menopause. They're activating and energizing, but they do seem to fire up the ability to concentrate and keep your mind on things a little bit better. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Favre, I have had several hobbies and activities in the past that I often enjoyed. Lately, I find that I am much less excited about these things and would rather just watch television most evenings. Is this a sign of depression or other mental illness? You got to be careful about kind of withdrawing and watching television into the evenings, even if it's PBS, because you got to maintain hobbies and interests. You got to maintain pleasurable activities, because a risk factor for getting depressed, and we're talking about sustained depression, unnatural depression day by day for at least a couple weeks, a risk factor for getting depressed will be not having pleasurable activities. So if you enjoy doing certain things, try to get yourself back into doing those certain things, even though you might not feel like it. In Indiana, we don't embrace winter like they do up in Norway and Denmark, where they try to get more active and they try to get more excited about different winter activities, and then they look at winter as a time where you can be more relaxed in getting things done. There's not as much yard work to do. You can get more reading done. You can do hobbies in the winter you probably wouldn't have time to do in the summer. So we need to embrace that in the wintertime as opposed to getting depressed because it's winter. So it's important to maintain some kind of pleasurable activities. I will often ask about pleasurable activities from many, many people, because I find that when people get depressed, they give up having fun. They give up their pleasurable activities. If you watch television, it's a very passive type of activity. You're watching there. You're not really using your brain a whole lot. You're not thinking so much when you're watching television because you're not interacting with the television. So you have to be careful about that passive type of activity, not only as adults, but for young adults, adolescents, and children at all ages. Passively watching television can be problematic in terms of really exercising the brain. Thanks for your email. Let's go to our next caller. Hello, Ben. Welcome to Matters of Mind. Ben, you'd mentioned your nursing and injury, and your prescribed steroid medications. Will that interfere with your anxiety medication, since a side effect of the steroids can be jitters? It depends, Ben. Some people, myself included, if I take a steroid, I don't need to sleep so much. It's kind of an energizing, revved up feeling, so I always am careful not to do anything financially when I'm on steroids for a back injury or something like that. So it's different for different people. Some people get more depressed with steroids. Some people do get anxious with steroids. You have to kind of play it by ear. It can be dose related. If the steroids are causing you more anxiety, your clinician can give you a medication temporarily that will actually help with the anxiety related to the steroids. If you already have anxiety and then you take steroids, you have to be very careful. Are the steroids kicking up the anxiety? Are the steroids provoking an underlying condition called bipolar disorder, where some people won't have big highs or big lows unless they're on the steroids? So if it's doing that, sometimes a mood stabilizer is necessary. So talk to your clinician about the possibility of you taking a medication to offset the side effect of the steroids. Steroids can be phenomenal for back injuries, for disc herniations, for skin conditions, for asthmatic conditions. So they're very, very helpful. Fortunately, they typically are just used for a short period of time. But if you do have side effects during that time, talk to your clinician about giving you some rescue medications to take care of those extra side effects from the steroids themselves. Thanks for your call. Let's go to our next caller. Hello, Sharon. Welcome to Matters of the Mind. Sharon, you'd mentioned your grandmother has bipolar disorder, now is experiencing dementia. What's the connection, and should you be concerned about developing that when you're older? Sharon, there's two conditions there. Bipolar disorder is a mood disturbance where people have highs and lows. There's no direct connection between bipolar disorder and dementia. However, Sharon, if you have untreated depression, which is the valley of bipolar disorder, untreated depression can increase the risk of dementia after 65 years of age by 4 times. So if you have untreated depression, it can increase the likelihood of dementia by over 4 times. What's the connection between bipolar disorder and dementia? If you have untreated highs and lows, yeah, it can be somewhat stressful to the brain. We see the same thing with psychosis, where if you have psychosis, you have an excessive amount of this chemical called glutamate. Too much glutamate, can be problematic, and too much glutamate is like putting too much salt on your food. It just causes more problems than it helps. So too much glutamate's like having too much fertilizer in your lawn. It can actually cause damage. So excessive glutamate can occur when people are having manic episodes, when people are having psychotic episodes, and in those kind of situations, it can precipitate dementia. Bipolar disorder itself is about 10% genetic, 90% not genetic. If you have a grandmother with bipolar disorder, but your mother and father or brother and sister don't have bipolar disorder, you're less likely to have bipolar disorder yourself. Dementia has a genetic component, but the number one risk for dementia is getting older. So as we all get older, our risk for dementia increases. There is a particular genetic risk factor called an apolipoprotein E2, 3, and 4 gene, and if you have a particular configuration of those genes, it can put you at a greater risk for dementia. If you have apolipoprotein E4 and E4 as two genes, that puts you at a higher risk for dementia compared to if you have E3 or E2. So, yeah, there's a genetic component. What can you do to prevent dementia? Try to stay physically active. I think it's the third time I've said that this evening. So staying physically active can decrease your risk of dementia. Staying intellectually active, trying to learn new things. I always tell people that going into retirement can be detrimental if they're not going on to a new chapter in their lives where they're doing more things and trying to learn more things. They're still socializing, they're still around people, they're still active in terms of their thinking on a day-to-day basis. So staying intellectually active will often be helpful. Be careful to keep your blood pressure and blood sugars in check because high blood pressure, high blood glucoses over the course of time can actually be a risk factor for dementia. So, you can't do anything about your genetics, but you can do all you can to try to decrease the likelihood of those genetics being problematic for you later on. Sharon, thanks for your call. Let's go to our next email question. Our next email reads, Dear Dr. Farber, if someone stops taking antidepressants because they don't feel like they need them anymore, will that person have withdrawal symptoms? Well, let's talk about those two questions in one there. Okay, let's talk about the withdrawal symptoms first. Certain medications can give you withdrawal symptoms because they get out of your system very fast. You can have worsening withdrawal. In order, I'd say probably paroxetine or Paxil could be the worst, followed very closely by venlafaxine or Effexor, and then probably desvenlafaxine, known as Pristiq, if you go off of that too quickly, and to a lesser degree, the so-called SSRIs, Lexapro, also known as escitalopram, citalopram, known as Celexa. They can give you some difficulty with withdrawal to some degree. The medication is less prone to giving you trouble with withdrawal. To use their trade names would be Trintellix, Prozac. Auvelity probably wouldn't that much. So there are some medications that get out of your system more slowly. So it depends on which medication you're taking to determine how slowly you should come off of it. If somebody's on Trintellix, Prozac, or perhaps Auvelity, I might have them go off the medication abruptly if they wanted to stop it for whatever reason. But if they're on Effexor or venlafaxine, I might taper them off over the course of 3 weeks just to make sure they don't have withdrawal. What's the withdrawal like? It's like experiencing zings and zaps in your hands, feet, and scalp. That's the most troublesome aspect of the withdrawal. Many people can get dizzy when they're going off of an antidepressant so quickly. They can feel kind of buzzed in their head, so we'll have them slowly back off on how quickly they're coming down the medication. So that's the second part of your question. The first part is, okay, if you're feeling well, can you go off your medication? It depends on how many recurrent spells of depression and how problematic they were in the past. If you've had just 1 or 2 spells of depression, they came on when something really bad was going on in your life, but the spells of depression went on for a week or 2 and they didn't cause you to lose your job or have a lot of problems with people around you, but they were there and it was annoying, you might be a candidate to go off the antidepressant and stay off the antidepressant if you've been doing really well for a long time. If you're only doing partially well and you're responding to the antidepressant but you're doing better but not well, you're more likely to have a relapse in depression and going off of it. So if you're doing well, you had fairly mild episodes of depression in the past, and especially if you don't have anybody in your family who's had any depression. Depression is about 30% genetic, so if you have somebody in your family with depression, you're more likely to endure recurrent depression. So that's the bad news. The good news is we do have some medications coming out now that are affecting not just serotonin, norepinephrine, and dopamine, which come from the brain stem of the brain. Brain stem is like the stem of the big old cauliflowers. That's the brain looking at you. The inside of it looks like this. The stem is down here. And norepinephrine, serotonin, and dopamine come from up there, come from down here, and they spray up to the gray matter of the brain at the top that affects your mood and your ability to think. Now, we do have medications now that directly affect the gray matter of the brain, where they affect glutamate. So these medications are ketamine, esketamine, also known as Spravato. We now have Auvelity, and a lot of medications are coming out in the future that are going to directly affect the gray matter of the brain. What are they doing? Well, they're basically fertilizing the brain without causing the toxicity that could be caused by some other medications. So these medications that are coming out might just work over the course of time and give you more of a persistent, almost curative effect for depression. We've seen that with postpartum depression with a medication called zuranolone, also known as Zurzuvae. It's a medication that you just take every day for 14 days for postpartum depression. You've had a baby, sometime within a year, if you have a lot of depression and it's directly related to the delivery and the pregnancy itself, and here you are with a new baby and you're really, really depressed, you're not able to get things done, you can't eat, you can't get out of bed, you just can't function so well. Zurzuvae is a medication. It can be very effective in just over the course of 14 days, and that's it. And most people just take it for the 14 days, and that's all they need. So I think in the future, we're going to be hearing about medications that are going to work very quickly, and they're working now very quickly, but they might be more curative as opposed to giving symptomatic relief, as we saw with medications we've been using historically for the past 60 years. Thanks for your call. Let's go to our next caller. Hello, Darlene. Welcome to Matters of the Mind. Darlene, you want to know what changes does the brain go through during pregnancy? It's mainly up in the middle front part of the brain. Take the brain apart here. Middle front part of the brain here. The medial cortex, the medial orbital cortex in the middle here will tend to be dysfunction such that people can have more anxiety. And when you have more anxiety, it's more difficulty with unnatural anxiety. You can have difficulty with sleeping. You can feel very stressed out. People will often ruminate during the postpartum pregnancy time period especially, but it's during that time you can have a condition called obsessive compulsive disorder where you tend to obsess unnaturally about things, often worrying about contamination. Now, to some degree, that's the mother bear effect because you're worried about contamination because you have a newborn baby coming along and you want to keep things clean. Your brain can sometimes overreact in that regard and cause you to have obsessions that are persistent over the course of several years. So with some women, I'll ask when they had the onset of the obsessive compulsive symptoms. The obsessions are unnatural thoughts that keep going around like a loop and you can't get them off your mind. You know they don't make any sense, but they're there. And then compulsions can be the actions or the behaviors that you do over and over again as a response to the unnatural looping thoughts. So that's obsessive compulsive disorder. For some women, it will have its onset after delivering a baby, and it's kind of a means by which the brain can have difficulty with networking information following delivery itself. And it's related to the abrupt decrease in estrogen and progesterone following delivery. So when you're pregnant, you have these extremely high levels of estrogen and progesterone. For some women, they say they actually feel better during pregnancy because those high levels of estrogen and progesterone. But then they crash and they drop abruptly right after delivery, and that can cause some people more anxiety, more depression, and there's ways to treat that now. Thanks for your call. Let's go to our next caller. Hello, Carl. Welcome to Matters of the Mind. Carl, you mentioned that you left a stressful job about a year ago and you're having difficulty going back to work. Are you experiencing post-traumatic stress, and what are the symptoms? Post-traumatic stress can occur in our day-to-day lives if we've had some kind of unnatural traumatic event that occurred. In other words, it's an unnatural traumatic event where you got hit harder than you would usually expect with an emotional, physical, sexual trauma, some type of trauma that you were enduring. If you had a workplace previously where you had a very abusive, emotionally abusive boss, yeah, that can be some PTSD. It can occur. When people have PTSD, they might have nightmares. They'll be jumpy. We call it hypervigilant. They'll have an avoidance of experiencing those similar type of experiences, and that's where you can avoid going back to work because of that type of thing. People with PTSD will often have sometimes mini flashbacks where all of a sudden they feel like they're reliving the past events, especially if they're provoked by hearing the voice of somebody or even experiencing a smell of something that reminds you of the past trauma. So people can have PTSD, not necessarily related to sexual abuse or combat or motor vehicle accidents where we often hear about PTSD. You can have PTSD with interpersonal connections if they were particularly traumatic for you. Let's go to our last email question. Our last email question reads, Dear Dr. Farver, why do some people with anxiety and depression ruminate in the past and get stuck in their thinking? I used to really like driving the manual shift automobiles because you'd go from first to second to third. When you ruminate with depression and anxiety, it's like getting stuck in first gear. And you just can't get out of first gear. It's almost like your brain is kind of idling during that time and you can't shift. There's a chemical by the name of norepinephrine that does allow you to shift a little bit easier, and it takes you from the so-called default mode, which is the lower gear of the brain where you're just ruminating about the past, not thinking about anything in particular, you're just thinking about different things in the past. But when you use norepinephrine to shift that gear into the salient mode then takes you into the thinking mode where you're actually making decisions, you're focusing on things and you're concentrating very intently. The thinking mode is called the executive mode network. So if you're ruminating about the past, you're just dwelling on things, people with depression and anxiety will have difficulty shifting out of that ruminative gear, and that's called default mode network. So there is a reason behind that. It has to do with the natural brain networking. When we're treating people for depression and anxiety, we're trying to keep that in mind. Thanks for your email. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you can give me an email and I'll try to answer them on the air. God willing and PBS willing, I'll be back again next week. I'm psychiatrist Jay Farver. You've been watching Matters of the Mind on PBS Fort Wayne, now on YouTube. Thanks for watching. Have a good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.